Welcome to Skyscape's Orientation Series. This is Part 3 in our faculty orientation, which is Critical Thinking in Every Lecture with Skyscape. Today, our presenters are Dr. Tim Bristol and Karen Sherrill. I will now hand the floor over to Karen.
Thank you, Kristen. I welcome you today to the third part of our series, and I'd like to introduce Dr. Bristol and myself. We've been using this program for a multitude of years, and I tell you what, it has really been very effective in the classroom especially. I think the beauty of the Skyscape program is that it lends itself perfectly to that active learning flipped classroom situation which we're trying to strive for in order to keep our students engaged. The first thing I'd like you to do is, if you have not yet viewed our Quick Start reference of faculty orientation, I encourage you to do that. It will really help you better understand the practical application we're going to be using in this component. So why is active learning important? Well, we know that it involves student engagement. We know that it meets a variety of learning modes and learning styles that our students have. And there has been research for many decades that have demonstrated how that active learning in flipped environment is really far more beneficial to a student's learning. What are some ways in which we can use our Skyscape programs in order to create that active learning environment? And I'm going to give you a few examples here, and then Dr. Bristol is going to demonstrate some of those examples as he walks you through the product itself. One of the activities that I've been using for years in my classroom is a practical application to a MAR. I learned a long time ago that lecturing pharmacology and medications really just doesn't do it for me. It doesn't do it for the students. It's very boring, it's very mundane, it's very difficult to make it exciting and active. And what I find oftentimes is it's pretty much reading off the slides and regurgitating information. And it's not using that critical thinking skills, which are so very important in our students as they learn how to work in this highly changing environment that we're introducing them to. So one activity that I've utilized is introduction to a MAR. Rather than lecturing pharmacology, I in fact will pass out to the students a medication record. And students will have on that medication record some baseline patient information. I'll provide typically a weight, an age, since those certainly can play a part in the pharmacokinetics and dosing of a patient. I'll give them also a disease process, so they'll know what the admitting diagnosis is. And then listed on this medication record is a list of the most typical, classic, common medications that a student would see if they were caring for a patient with that particular disease process. I oftentimes will incorporate into it some designated red flags, high alert information, so that students hopefully will catch on to that and recognize that it's an abnormality. For example, if I'm doing a medication record on a patient with renal failure, I'll make sure that I'm adjusting my dosaging of medications accordingly, and to see if students can start to detect that this is a lower dose than what they would give to a normal patient, so we can have that discussion about a renal perfusion and about how to excrete medications for the body and how that impacts our patient care. So after I've set this MAR out to the students, and I've had them work usually in pairs or in small groups, and I will give them a list of questions or topics that they need to identify. They'll tap into their Skyscape materials and resources in order to answer those questions. Some of the common things that I ask them is asking the drug category of each medication on the MAR, and I'll have them also compare and contrast and look at other medications within that same drug category. I'll ask students about normal and safe dose ranges. I'll ask them about the correlation between this medication and the pathophysiology of what's going on with the patient. Can they make those connections as to why it is that this medication would work effectively based upon this disease process and what's going on within the body? And of course, I always tie it into nursing considerations and contraindications, similar to the type of material and information students would be looking up if they were going to be delivering this medication in the clinical setting. And I oftentimes will encourage them to use these same techniques when they are in clinical, making sure that they're looking at this medication fully, comprehending and understanding how to provide that to their patients in a safe manner. Another activity that's very effective and similar to that is, in fact, utilizing labs. and you can give your students a lab report. Oftentimes with this one, I won't have any diagnosis on the top of the page, yet I'll let the students try to explore and determine what's going on with that patient. I like to give trends in labs. You know, you give single isolated lab, it doesn't tell nearly as much information. If you watch a patient's trend over a period of 2 or 3 days, you can learn a lot more about the progress of the disease process, as well as how medical interventions have worked effectively in the care of that patient, and talking about ways in which nursing can be actively involved in that collaborative process of caring for that patient. Once the students have this lab report, they need to go into their Skyscape resources, tapping into the appropriate resources that they need, starting to determine what's going on with their patient. Can they start to recognize that this patient has a high glucose, and why might that be related to a pH that's in an acidotic state? Can they make those correlations with the fact that the potassium is high, and recognizing that this is a diabetic ketoacidosis situation? I'll have students walk through the process of appropriate medical as well as nursing interventions pertaining to that. So the students recognize, because on that lab report the potassium is high, that they need to apply an EKG monitor. Will they look through their resources and see those appropriate nursing and medical interventions that go along with the care of that patient? Oftentimes I'll introduce them to an SBAR with their healthcare provider. They have to write up an SBAR note, and they have to really focus in on the R, the recommendations. What would they request from their healthcare provider if they were writing some admission orders on this particular patient with these abnormal labs? Can they tap into those resources and find appropriate things in which to request and recommend to the physician in the care of that patient? After they've completed that for their first day of labs, I'll then have them transition to the second day. They can watch the trends in that patient to see whether or not those medical interventions and nursing interventions and the care that we delivered made a difference in the outcomes of that patient. So that's a real fun activity to use. You can also utilize Skyscape through case studies, having students looking up information within case studies, again, working in pairs, working in groups, working in small teams. And I also like to take that to the next level, which is once they've collected that information, to have them presenting that information to the class. After they've utilized their Skyscape resources and learned the answers to this case study, have them then turn and teach it to the class, which provides a much higher level of understanding and learning when they're able to teach the information that they've just been reading about. This part of the presentation, I'm going to go ahead and turn this over to Dr. Bristol, and so he can show some demonstrations on the Skyscape product, so how this could better work in your classroom.
Thank you, Karen. When we look at using a clinical tool during lecture, the benefit really can be significant, because what you're doing when you're helping a student understand a concept and you're using a clinical tool to do that, you're using that clinical tool, if you will, as a vehicle for application, not only a vehicle for cognitively functioning in the application realm, if you will, but applying what they've learned in class when they go into the lab, when they go into the simulation, when they go into the clinical. So I look at this as an excellent opportunity to do just that. And we can come at this a couple of different ways. So I teach pharmacology often, I teach med-surg often, and we could have a case study where we have a patient who is in heart failure, and we ask the students, now, diuretics, what role do diuretics play in the patient who's struggling with heart failure, suffering from heart failure? And we can actually have the students go into their clinical tools here, and the informatics word, the fancy word here, is a clinical decision support tool. Essentially, we're making clinical decisions here, and this tool is helping us do that. So instead of me saying to the students or telling the students, you know, what role diuretics play in helping patients with heart failure, when I tell them that and they write that down in their notes, they're functioning at a knowledge and comprehension level. But when I ask them, and they have to come up with the answer, get them in groups of 2 and 3, they gather around someone's phone, someone's iPad, they open up Skyscape, and they'll just go into the smart search area up here at the top. They'll type in diuretic, okay? And they're looking here, and they're going, okay, Tim told us to look up diuretics. Where does this show up? Well, The first place that it shows up, of course, is in the Davis Drug Guide, and I tap on this, and this is, again, is a clinical example because it pulls up all these different types of diuretics. So what I'll tell them to do is pick these 3 diuretics. Now that you've found this list of diuretics, maybe we'll pick a furosemide, maybe we'll pick spironolactone, maybe we'll pick that triamterene. And what we'll do, I do a lot of with prioritization. Okay, so I'll say, okay, students, now you've picked your you've looked at the list of diuretics. Now we're going to look at furosemide. Now what I want you to do in groups of 2 and 3 is I want you to come up with 3 priority assessments, 3 priority interventions for a patient who's using furosemide. Okay, and what does this have to do with heart failure? How does this help the patient with heart failure? And really have the students work through this cognitive process. And I'll say, okay, now go back here, go back to your list, and let's pick that potassium-sparing diuretic, spironolactone. Do the same thing. By having them repeatedly do the same thing, the same activity, and when I'm teaching med-surg, they will continuously go through that same activity, using their clinical decision support tool. I also call Skyscape my evidence-based practice on the fly. Okay, using this repeatedly develops a habit that means that they're going to start to need it in clinical. They're going to be looking at a medication. They're going to be taking care of a patient. They're going to go, okay, wait, stop. Where's my Skyscape? Where's Skyscape? Where do I find it? And it's just going to be a habit. It's just going to be part of the way that they think. And we know from research, we know from the Institute of Medicine, we know from CUSIN, students need to be thinking with these tools in their hand. That's how they need to be processing, because we know that it's actually dangerous, according to the Institute of Medicine, for a nurse to rely solely on memory. And so by teaching the students how to process, how to move into the application and analysis level of learning, cognitive processing, with this tool in their hand, you're going to really provide a lot of benefit to them. Another example, so for instance, how do I look across resources? So when you're writing test items for your lectures, we know that if you can find the answer to a test item on one page in one book, it's not a high-level test item. And actually, you need to go to multiple pages in multiple books. Well, there's a clinical application for that here in Skyscape. And so I'll say, okay, students, let's go into our diseases and disorders. Let's look up heart failure here, okay? There's my heart failure. Now, take a look around the monograph for heart failure students, and I might put them into a prioritization activity. What are the 3 priority assessments, the 3 priority interventions for a patient who's suffering from heart failure? Now, students, what I want you to do is use our Smart Link. And you'll find Smart Link. You'll look down here in the lower left-hand corner. You'll find Smart Link. And I want you to go ahead and go into your drug guide, and let's start talking about the different medications that you're most likely going to see. So there's your ACE inhibitors. There's your dopamine. There's your electrolytes, your diuretics, your beta blockers. They're all there. And I'll say, okay, now let's go ahead and pick that diuretic. All right? Students, I want you to come up with 3 priority assessments, 3 priority interventions, okay, when it comes to taking care of a patient who's using a diuretic as far as a heart failure situation is concerned. So as you think about this tool, I really try to, during my lecture time, I try to replicate consistently, repetitively, using these tools quickly and effectively for high-level processing, high-level thinking, showing them how multiple tools are connected simultaneously. I really believe that this is important, that we create habits for our students of using evidence-based practice on the fly. And the best place to do that is during lecture. So if you're doing a 3-hour med-surg lecture, I really believe that your students need to have Skyscape open, active, and using it at least twice per hour. You need to get it out about twice per hour, having the students walk through these activities. We want these to be habits. We want these to be habits so that the students cannot function without them, that the students are using these tools, the way the Institute of Medicine describes it, as a safety feature when it comes to caring for their clients. I'm going to turn it over to Kristen now. She's going to wrap it up for us.
Thanks, Tim. So Skyscape, you could kind of think of it as a galaxy of tools here. Basically, you have your Skyscape Medical Library, and that is the references that Tim just went through. In addition to that, we have a word game, SnapWord, which allows you to look at different organs, skeletal systems, and learn about that stuff as well as practice your spelling. That's available in the iTunes store right now. We also have the Nclex question of the week, and that is available at skyscape.com/Nclex. QOW. That comes out each week. You can try your skills, or your students can try their skills at the question and answer. It gives the answer as well as the rationale. They can also attempt past questions, and we will also have the ability to allow faculty to submit questions and have their own pool as well. We have something else coming out. It's the Nursing Skills Hub, which is a skills checklist. It'll have 25 free skills that you'll be able to go through that have step-by-step instructions on how to do the procedure, as well as an associated video. And then for a paid fee, there'll be an additional up to 100 skills that will be available. We also have a Shush Docs, which is out on the iTunes store, which is a encrypted document sharing tool. And we still have our tool NTrack, which is a clinical log that is a web-based tool. We have a lot of things that are available. You can learn more about what Skyscape has at our groups page, which is listed at the bottom of the slide. I'd like to thank you all for your time today, and I hope you found this informative. Thank you, and have a great afternoon.